Hi, I'm Dr. Kurt Woeller. I want to talk about foundational, fundamental supplements useful in autism. And for many years, I've developed what's called the four-pillar approach to autism within this context of biomedical intervention. Those four pillars are diet, so good nutrition, foundational supplementation, gut assessment and health, and then methylation support. And that's really those four pillars. Now, let's talk about foundational supplements. One of the reasons that foundational supplements, what I mean is multivitamin, multimineral, antioxidants, essential fats, things that include B complex vitamins, vitamin C, these essential nutrients, is that it's well known that many autistic individuals are deficient in different types of nutrients. And a lot of that comes about because of their rigidity to eat a diverse amount of food. That doesn't mean you as a parent or caregiver aren't trying your best to get them to eat healthy, but many times the autistic child, teenager, or adult is just resistant. Now, maybe they have a sensory problem, there could be a texture issue, or maybe it's just a gut problem in their ability to absorb nutrients. Perhaps there's bacterial overgrowth happening in the small or large intestine, or there's a fungal imbalance. And so these supplements help to fill in those gaps nutritionally. And I've seen tremendous clinical benefit occur from that. Eye contact, improvements in language, environmental awareness, better sleep, better memory. And it's critically important for children, right? I mean, children are constantly growing and developing. And there's a lot of metabolic energy that needs to occur in order to maintain normal function within the body. And particularly the brain and nervous system uses a lot of metabolic energy. I've actually seen protocols that are just solely focused on fixing the gut. And there's nothing wrong with trying to fix the gut. If there's a bacterial overgrowth problem, a fungal issue, inflammation, yeah, that needs to be dealt with. But I've seen scenarios where people are taking gut supplements for many, many, many months and not using some of the more foundational supplements, the multivitamin, mineral, essential fats that are necessary for the body. And so the approach is, well, let's just fix the gut and then everything else will work. The problem is you're losing months and months and months of time where many of these other nutrients could be helpful overall for body metabolism. And I realize everybody's a little bit different, but as a general rule, in my experience, these foundational supplements are often just supportive and complementary to other treatment that is occurring, including gut treatment, of yeast problems, inflammatory issues, bacterial overgrowth. So that's really my take and my experience with these foundational supplements. When I talk about foundation, what they're doing is they create a foundation of health, right? We have to have these pillars in place in order for us to really get a lot of benefit from other more advanced types of therapies. But many times we get tremendous clinical benefit by working on diet, working on gut, and working on just foundational supplements. They are the key that helps to unlock the many other doors that may need to be, explored for additional benefit. But if we bypassed these fundamentals, we oftentimes won't get benefit from some of the other types of, biomedical interventions that exist. And that could include methyl B12, that could include hyperbaric oxygen therapy, that could include heavy metal detox therapies, for example. Okay, thank you. I'm Dr. Kurt Woeller. Thanks so much.